Hello everyone, my name is Nicole, and today I will be talking about neonatal lupus. The purpose is to inform you what neonatal lupus is, how you can get it, and how long does it stay. Neonatal lupus is the short term of neonatal lupus erythematosus. Neonatal lupus erythematosus is a deficiency in the antibodies usually carried from the mother. It is a very rare disease and is often shown and seen through newborns. How can you get it? Newborns typically get neonatal lupus through the mother. Now, what is very interesting is that the mother actually doesn't have to be an active carrier of the lupus antibody. However, she can be asymptomatic. Asymptomatic means that you carry the antibody, but it is laying dormant and you have no symptoms, and also you do not have active lupus. How long does it stay? Typically, newborns carry neonatal lupus or the antibody until they are about 6 months. However, it can last longer with the effects of what the neonatal lupus does to the body. Neonatal lupus can not only affect the skin, as we see here, it causes lesions on the head and sometimes a rash on newborns. This is typically the telltale signs for doctors and most mothers to know that something is going wrong. Now, not all lesions and not all rashes are defined as neonatal lupus. When a baby does have a rash or comes into the doctor's office with these lesions, a biopsy can be done. It is not always done, but it can be done just to identify what it actually is. When the biopsy is performed on the infant, they usually cut off a piece of the skin, take one of the lesions in, and they run it to the lab to see what it actually is. Now, some of these rashes will go away on their own, and sometimes you may need cream. However, they do not last long. The liver is also affected by neonatal lupus. This is not all the time, but sometimes it can be affected, in turn leaving you to have to do common checkups with the doctor 6 months to a year. These symptoms are sometimes treated by more sunlight, which will take away the yellowness of the baby's skin, sometimes known as jaundice. Also, as you can see on the chart here, ages 8 to 12 sometimes show more of the severity in their liver and their kidneys. However, as they go on into adulthood, you see that it does decrease in the percentage. Neonatal lupus is not something that we typically learn about as women or as pregnant women from the doctor. But it is so important. As mentioned before, the mother does not have to be an active carrier. It is not typically hereditary, but the antibody can be. It is important to know what it is, how you can get it, and how long it stays. Again, neonatal lupus needs to be learned about. We need to be informed. We need to know what the causes and what the risk is, and we need to get checked. As the website says on lupus.org, that it is very common for women to get checked and to be sure before carrying out a pregnancy if they carry the antibody or not. Thank you.